Is prednisone safe during pregnancy? Really important question because pregnant zone is actually what the video transcriptions often think I'm saying when I say prednisone, pregnant zone, which isn't too far off when you think that one of the main side effects is a big round belly from taking prednisone. But back to the question. Is prednisone safe while you're pregnant? What's really great is a new guideline just came out about pregnancy and medications used for rheumatoid arthritis. And since prednisone is one of the main medications used, this kind of answers our question. So who created this guideline? This is the European League Against Rheumatism. These are essentially the best doctors, rheumatologists in Europe. And they got together and talked and looked at all the literature and all the evidence and decided the following things about prednisone, pregnancy, and breastfeeding. Plus, I will also share other medications that you should avoid according to this guideline. So why would a doctor prescribe prednisone during pregnancy? Well, it would be because there must be something so harmful to the mother to justify its use, such as lupus, rheumatoid arthritis, asthma, Takayasu's arthritis, lots of these incredibly inflammatory and potentially autoimmune diseases, where the mother is going to be harmed so much that the damage to the mother may damage the baby because of the disease itself. So for example, with asthma, the mother's not breathing very well. And that lack of oxygen can lead to brain damage in the baby, right? So it's more important to have a mother fully breathing and oxygenating than the concerns about medications. So let's learn about uncontrolled inflammation and disease flares can be seriously harmful to both the mother and the fetus, leading to complications like preeclampsia and preterm birth. So the doctor prescribes prednisone to suppress inflammation, to protect the maternal and fetal health, and suppress an overactive immune response. So since I'm a pharmacist, let's talk about the drug itself. If a mother takes a prednisone pill, does it get all the way to the baby? So there's this wonderful thing Mother Nature created called the placenta, the barrier between the mother and the baby. And the placenta breaks down prednisone. It's metabolized by the placenta, meaning that only small amounts of it makes it to the fetus. Studies have shown 8 to 10 times less exposure to the fetus than to the mother. There used to be concerns about birth defects when taking prednisone. There were some early suggestions of a link between prednisone and cleft palate, but recent studies have found no evidence of cleft palate since at least 2003. Some studies have found a link between prednisone and preterm birth or low birth weight, but it's more likely due to the mother's underlying disease itself and not the prednisone. Most studies show that prednisone has very minimal risk when controlling for disease severity. So what did this European League Against Rheumatism guideline actually say? I'm going to read it for accuracy and completion's sake, and then I'm going to translate their medicalese into how to apply it. They say, in pregnancy, prednisone and prednisolone should be tapered when possible to a maintenance dose of less than or equal to 5 milligrams a day, and when possible, withdrawn. The use of higher dosages should be weighed against the risk of maternal fetal complications. Prednisone and prednisolone are not associated with an increased rate of major birth defects and can be considered during pregnancy if needed to control active disease. However, due to dose-related potential risks for the mother and fetus, use in pregnancy warrants careful consideration. Adverse effects of glucocorticoid treatment during pregnancy over a prolonged period at higher doses may comprise pregnancy-associated osteoporosis, gestational diabetes, serious maternal infections, and preterm birth, whereas daily doses less than or equal to 5 milligrams are associated with low risk. Follow-up of exposed children showed conflicting results with regard to infection rates, but normal developmental milestones, and no increased risk for insulin resistance. In view of the current evidence, we recommend restrictive use of oral glucocorticoids in pregnant women. So you wouldn't want to do this just for the fun of it. You would only want to do it if needed. They don't see any complications, no birth defects. The real problem is really what's happening to the mother because of prednisone itself as a side effect, not really what's happening to the baby, really. Like, there's not really risks to the baby, it's to the mother. And the risk of infections, osteoporosis, and diabetes are real. And this happens to any human taking prednisone. And we don't want those complications for the mother, right? So here's some other medications that they said to avoid or are giving reasons to minimize their use. Methotrexate can cause miscarriage and birth defects and needs to be stopped 1 to 3 months before conception. Mycophenolate mofetil or Celcept, it can cause miscarriage and birth defects and needs to be stopped 1.5 months before conception. Cyclophosphamide, again, can cause birth defects. Leflunomide, birth defects, needs a drug washout procedure actually, and discontinuation at least 3.5 months before conception. JAK inhibitors like Xeljanz and Rinvoq, they just don't have enough safety data yet. Maybe sometime in the future they will be, but right now they just haven't been tested in pregnant women. And some more that they just don't know enough about include Otezla, Tracleer, Tavneos, and Lupkynis. So some they suggested that are safer in pregnant women include hydroxychloroquine, azathioprine, sulfasalazine, TNF inhibitors like Remicade and Humira. They said basically all the TNF inhibitors are considered safe during pregnancy. So basically, what should you do if you're pregnant and you're on prednisone? As with anyone, get to the lowest effective dose for you and your disease. The guidelines suggest getting to less than or equal to 5 milligrams a day. It's best for people who have severe refractory disease with nothing else working. But if you can, use one of those alternatives I mentioned. So with everyone taking prednisone, it's always a question of weighing the benefits and the risks. Untreated autoimmune diseases and inflammatory conditions pose risks to the mother and the fetus, so you've got to be getting the treatment you need. Prednisone can help control the disease activity, but prednisone can cause side effects, especially to the mother, that can be harmful as well. So work closely with your doctor to find the lowest effective dose for you. Find the alternative medications that you can get on to minimize the dose so that you can be on the very lowest effective dose for you. What about breastfeeding? Prednisone is generally considered safe during breastfeeding, especially at low doses. Breast milk contains minimal prednisone because of its shorter half-life. To minimize infant exposure, the EULAR guidelines do recommend waiting 2 to 4 hours after you're taking prednisone to minimize infant exposure. But if you happen to have to need high doses, like I did when I was breastfeeding, there's a chance it might turn off your milk supply. I took prednisone 60 milligrams for my autoimmune condition. While in the hospital, I was pumping and dumping because it was such a high dose. And then my milk supply just stopped. I was no longer able to make milk. So I had to wean that baby early, and it was very sad for both of us. But it was okay because his mommy was still alive. I was not going to bleed to death. So finally, prednisone is a safe and effective medication that should be used at the lowest effective dose for either pregnancy or breastfeeding. Definitely talk to your healthcare provider, talk to your pharmacist. They can help you find the best medication, the safest option for you and your baby while you're in this very exciting time of life. Congratulations on your upcoming baby. This is so exciting. Coming from a fellow mother of 5 children whom I love. If you ever need other help with prednisone side effects, you can download my Prednisone Checklist. It's a free PDF, and it includes my best tips of how to minimize those side effects that I've mentioned, like osteoporosis, blood sugar issues, diabetes, and more. Just click the link below to download it now. Signing off as Dr. Megan, your prednisone pharmacist.